Good morning, everyone. We'll go ahead and get started. We'll call our Public Health Committee meeting to order. This is Wednesday, February 19th, 2025 meeting. Um, So this will be our, today's a deadline to raise concepts. But today we'll be raising a concept, but also be doing a couple of bills on JFing them as well. If we have a vote on these bills, we are going to keep the votes open till 2 p.m. With that, I'm going to ask my co-chair if she has any comments.
Thank you so much, Senator Anwar. And just a reminder that as the committee does its work, today's the last day that we will raise concepts or separate titles for bills. We as a committee working together in a bipartisan way will be continuing to work with all of you, our members and others to make the necessary changes bills as we get more input and gather more information. I just want to point that out. Always, this is an evolving process as we take in the input that we receive. Thank you very much, Mr. Chair.
Thank you. And Representative Claire Teacher.
Thank you, Mr. Chair. Good morning, everybody. Let's get going.
With that, I think Senator Summers may join us in a little bit. We have multiple meetings happening simultaneously, so you will see people coming in and out. With that, the concepts to be raised, can we have a motion to move an act concerning nitrogen runoff reduction requirements concerning residential developments? Is there a second? Second, and did you get it's been moved by the Representative Claire, Representative McCarthy Vehi, and Representative Belton has seconded this, and there's a question.
Thank you, Mr. Chair. Can you just give us a little summary of what this bill entails?
I was hoping you wouldn't ask me this question, but I can give you the. So human activities result in a nitrogen production, and that nitrogen production results in an impact on the environment, and nitrogen can connect with water, and there's a chemical reaction which produces nitrous oxide, which may have an impact on the environment. Now, this is not the nitrous oxide that you inhale in your dentist office, so don't feel about that, but there is requirements for residential communities, and depending on what the location is, that allows one to be able to have certain guidelines for creating these residential facilities. So it's worthy to look at what is the right amount, and is there opportunity to address this and fix this from a public health perspective. And that's the reason it's in this committee, and that's the rationale. Thank you. Yes, Representative Kristen McCarthy Vehi.
Thank you, Mr. Chair. And as I mentioned at the beginning, we're raising a concept. So I think there is still some ongoing conversation as to what specifically will be raised in the bill. I think there is some conversation about creating a working group to look at this. I think actually we're hoping to have a meeting with DPH and DEEP to talk about this issue with the public health leadership and the environment leadership, along with some other issues on a few other bills. So I would suggest that this is probably a bit of a work in progress as well.
Yes, Representative Mara.
Thank you so much. And just to clarify, is this around like multifamily housing units? What is, I'm just not sure what the scope we're talking about here is.
Do you want to answer that? Yes.
The bill, we did not raise the majority leader's House bill that was proposed, and this is related to potential regulations that both DEEP and DPH have. Again, still looking into all that. So it is making sure that we are protecting public health and the environment, and also addressing concerns related to some of the costs of housing development. So there is connection and nexus there.
Representative Zupkus.
Thank you, Mr. Chair. I admit I don't know anything about nitrogen runoff. What is it? Where does it come from?
It's in the sewage system.
All right, thank you. And so someone has said that there are problems with the sewer systems in residential area, and is that what we're looking at here?
Or I'll answer and my co-chair will add to that as well. So there's a certain amount that is considered safe. And that's the rationale. And sometimes there's more than one source of the nitrogen as well. So with that in mind, there's supposed to have some safety around the well-being of the people residing in that area and beyond. And that's a rationale for looking at this. And I think that's why it has a overlap between environment and public health. But my co-chair will add to it.
No, I think you did a nice job, Mr. Chair. There have been changes in terms of who is regulating which kinds of systems, and without getting into the Planning and Development and Environment Committee details, that is part of the conversation here. So that's why I said there's a work in progress piece of this, because in those changes and in the development of the regulations, I think there have been some questions raised. So again, this is raising a concept so that we can have a hearing and actually learn more and ask some of these questions as well.
Thank you, and I appreciate it. I would think that we have some very strict regulations around those things right now, but it will be interesting to hear. Thank you.
Representative Reddington Hughes.
Not to be naive in this, but my question has to do with, are you talking about the septic outside of the nursing home? Or are you talking about things that are happening inside the nursing home?
It's more in the residential environment that we're looking at. We are looking at the regulations that are existing and see if there's an opportunity to fix that. I think that's the rationale for this.
Right. Thank you.
Thank you. All right, seeing no other questions, we can have a voice vote. If all those in favor can say aye. Go ahead. Aye.
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 Right. Nitrogen moves forward. The next item is number 4, bills to be considered for JF action. We will entertain a motion for SB 1190, an act requiring nursing homes and assisted living facilities to be equipped with an automated external defibrillator, with a proposed action as a JFS to the floor with the LCO 5084. Do we have a motion? Representative Jenga and Representative Clarice Jeter seconded it. And I can give you a little bit of a background and so that people are aware. The JFS language is just for technical revisions. This bill requires administrators of nursing homes and managed residential communities by January 1st, 2026 to provide and maintain an automated external defibrillator that is an AED in a central location at the facility. They must make the AED's location known and accessible to the facility staff members and residents and their visiting family members, and also maintain and test the AED according to the manufacturer's guidelines. The bill also requires administrators of nursing homes and assisted living services agencies by the same date to ensure that at least one staff member who is trained in CPR and AED use under the standards of the American Red Cross or American Heart Association is on the premises during all hours of the operation. So that's the background and what the bill will do. Representative Clarice Jeter.
Thank you, Mr. Chair. I will be supporting this bill today. I think it's critically important to have AEDs in as many places we can. We know that we see them more and more in public places. We have them here in this building. We have them at the Capitol because we know that seconds and minutes save lives. So if we have the opportunity to save a life in a assisted living facility or nursing home, I think this is critical legislation to move forward today. Thank you, Mr. Chair.
Thank you. Seeing no, Representative Jenga.
Thank you. It's surprising that we have to to mandate this. I think nursing homes, because of the way they are and the results of AED comparison to CPR, should be a no-brainer. We put these in place in East Hartford 30 years ago when they first came out. And the results, it's so easy to run, and comparison to what CPR has required of individuals and the training. The training for this is just so elementary that I certainly commend whoever brought this bill forward.
Thank you. And when we were looking at this, we have them everywhere, but this was somehow missed. And we said, how is it that we missed this? This should have been one of the first few places. Now we are making sure many of the nursing home actually have been very forthcoming and they did this on their own, but they were not required. But now they will be, hopefully, after this next phase. Representative Mara.
Thank you. I have a question and then possibly a comment. I do love the idea of this bill. I mean, that makes sense that we've missed them along the way. But my question is so is CPR going to be required and AED training required for both nursing homes and assisted living facilities?
So we need to have at least one person available to be able to manage that. Yes.
Okay, so one person that would be there for a 24-hour period, 24 hours a day, we would need that.
At each shift. So
Okay.
it will be different person in each shift, but in these facilities, there should be one person who should be trained to be able to use this, but also be trained in CPR.
Okay. And while I do agree specifically with nursing homes that makes a lot of sense. When we talk about some of the assisted living facilities, my concern is that there's probably assisted living facilities that have more where the residents have more autonomy, and I'm not sure, are we like adding requirements on certain assisted living facilities that may or may not have the staffing requirements to handle that. So that's my concern. Certainly I see it in nursing homes, but that's just my concern with assisted living. And I hope you all keep that in mind as we move this bill forward.
Thank you. Representative Miko.
Thank you, Mr. Chair. I would join my colleagues in commending the folks who put this bill forward. My only question would be, is there any kind of enforcement mechanism to make sure that this is actually carried out ultimately?
Thank you. I appreciate your comments and seeing no. You have more?
So, Mr. Chair,
Oh,
my question was, I didn't see it in the bill, perhaps I missed it. I'm looking for an enforcement mechanism to make sure that these items are actually installed and that the training takes place, everything that the bill calls for. Who's going to be enforcing it?
The agencies that enforce them, everything in these facilities to begin with. DPH would be the one in nursing homes.
This would be the DPH that is already overburdened and overwhelmed with all the other things they have to do. They're going to be enforcing this. Do I understand that?
The DPH that is so committed to wellness of our state
Fair
is
enough.
going to be continuing. to do
Okay.
this. Thank you.
Okay. I hope you're right. Thank you, sir.
Thank you. Seeing no, Senator Summers.
Hi, I don't have much of a voice, but I just wanted to say that I'm glad we're going to hear this bill, but we may be pleasantly surprised and find out that more of these facilities actually have these in place. We're just hearing about maybe the one or a few that do not. So I'm going to be positive about this and think that they're doing the right thing as we speak. And maybe enforcement will not be as big an issue as people may think. Thank you.
Thank you. Representative Claire Dieter.
Thank you, Mr. Chair. My other question with this is currently, and it's in this bill in the current form, it's a mandate to have one person, you said per shift, that's trained in CPR and AED. I don't really even think we need that. We have these in public places. The Good Samaritan law does apply. So I'm not quite sure that we even need to have it mandated that someone is trained in it per shift.
Thank you. I'll just add that it's good to know how to use these AEDs and then do this when things are not in a critical situation. I think that's the benefit of having somebody trained to use it. It's pretty easy to look at it, but you don't have the luxury of doing it when there's an emergency. So that's the rationale behind that, I believe. Representative Kennedy.
Thank you, Mr. Chairman. I just have one question. Usually these have to be calibrated at certain times and everything. I don't see anywhere in the language. I know in some towns, I believe the fire departments will come in and calibrate this. Do we know how these are going to be
Sure.
updated,
Thank you.
calibrated?
It does mention that they will be maintained and test the AED according to the manufacturer's guidelines. It's okay. Thank you for that question. Seeing no other questions or comments, Madam Administrator, can we do a roll call, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCory, Senator Summers,
Summers votes yes.
Representative Clara Desdichia,
Clara Desdichia votes yes.
Representative Burger Givallo,
Burger Givallo votes yes from a parked car.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné, Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Senator Gordon votes yes.
Senator Harkadel,
Senator Harkadel votes yes.
Representative Kavris DeGraw, Representative Kitt, Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez, Representative Parker, Representative Maureen Bello,
Yes.
Representative Perello, Representative Paletto,
Yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Steinberg,
Yes.
Senator Slapp, Representative Zupkis. Thank you, Mr. Chair.
I'm sorry, I missed my name. I was talking, to be honest. Yes.
Thank you.
Thank you. And then we'll keep the votes open till 2 p.m. So I know many people are in different meetings, so we want to make sure everybody has the opportunity. With that, we'll move on to the item number 2 in the Roman numeral 4. This is about HB 6836. We'll entertain a motion to raise to JF an act concerning the Department of Social Services recommendations regarding the implementation of the state's advancing all-payer health equity approaches and development federal innovation model hospital global payment methodology. Can you repeat after me, Emma? All right. Do we have a motion?
So moved.
Moved by Representative McCarthy Vehy. Is there a second? Second by Representative Belton. Thank you. I can give you a little bit of a background and we can have a conversation after this. Keep in mind that some of these bills are quite complex and what we are passing out of JF today may not necessarily be the final version, but at least it's a way to move things forward because many of these bills may have opportunities of further improvement. But the current form of the bill, the JF that we are JFing to the floor, this bill authorizes the Department of Social Services starting January 1st, 2027 to implement a global budget payment methodology for licensed acute care hospitals, including Children's Hospital, with that volunteer to, and then the word volunteer should be underlined, to participate in the state's advancing all-payer health equity approaches and development called AHEAD Federal Demonstration Program. Under the bill, the global budget payment methodology replaces the existing fee-for-service payment methodology for participating hospitals and applies to all included service categories. Ahead is an 11-year federal demonstration program from 2024 to 2034, administered by the Centers for Medicare and Medicaid Services. And yes, it's still going to function. Under the program, the state will increase the percentage of healthcare spending on primary care, use hospital global budgets with related performance and equity targets, and hospital participation is voluntary, and create a statewide health equity plan. Connecticut is the program's second cohort, which begins operating in January 2027 after a 30-month implementation period from July 2024 through December 2026. And the date for 2024 is retroactive. CMS provides up to $12 million total per state for up to 6 years to support the program's implementation. So simplistically, this allows us to be able to have more robust primary care so that the people will get less likelihood of getting admitted to the hospitals. And this is a model that has worked in some of the other states. There are kinks in the model that we have all talked about, but we feel it's worthy to move forward with this for further discussion. Representative Claritas Dietrich.
Thank you, Mr. Chair. I have a lot of concerns about this bill, as I know the hospitals in our state are screaming right now. This is, as we know, a volunteer option for hospitals, but we don't know how many hospitals need to volunteer for this to be viable. It's 1.2 million per year for all our hospitals. I don't know how that's sustainable. Well, I feel we're going to be in the same situation with the hospital settlement. The hospitals are going to, what's going to happen? There's no money left. Oh, it's our, now it's our responsibility. I just don't think, and also it doesn't fix the underlying Medicaid issues. If these hospitals are locked into this for, they said 6 to 9, 10 years without Medicaid increases, how is that sustainable? When was the last time we had a Medicaid increase? I mean, before the hospital settlement, it was 2016. After it was, whether I'm off, 2018. I just don't think where we are right now that this is a viable option for the state of Connecticut. And I hope my fellow legislators vote against this today. Thank you, Mr. Chair.
Thank Senator Summers.
Yes, I am very concerned about this bill. If I was a hospital, I would never volunteer to sign up for this program. I just see it as the feds providing a hilariously low amount of funding for our medical systems. I don't see how it's sustainable. It basically overhauls a big aspect of how hospitals are funded. I know that the disability rights of Connecticut are against this also. I think the only people that are really supporting this are DSS and OHS and OHA. So I am going to be a no today on this bill. I have not had an opportunity to research any other state that this has worked well at all. And I think it's a move in the wrong direction. For having issues with hospitals surviving in the state of Connecticut, as we all know we are, this is just another step further into making it more difficult for them. So I'm a big no on this today. Thank you.
Thank you, Senator Summers. Senator Gordon.
Thank you, Mr. Chairman. And I'm also going to vote no at this time in this bill. I have very serious concerns with regards to what the impact could be adversely on our hospitals, including hospitals that choose to participate that already are struggling financially. I read through all the testimony. I note the people who really are in support seem to be government agencies, and I don't agree with some of their viewpoint on what might be that this is beneficial across the board. There's just a lot of concerns raised, and a lot of the testimony did hit the nail on the head about a number of concerns, way too many for me to list right now. And for those reasons, I can't support this bill at this time. I think we really need to work more on this to really better understand what the impacts might be, but also really address the legitimate concerns raised by the hospitals, including any of the hospitals that are already struggling financially, and this could be hurtful for them with a system like this. Thank you.
Thank you. I'll just clarify a couple of things. I want to make sure that they're highlighted. One of the things is that the hospitals have a right to opt in or not be part of it. So that covers that aspect. I'm just sharing that. And the 12 million are for the implementation of the program. It's not for the services. 12 million for services would be like 2 hours. So I just want you to be aware that it's just for the implementation of the program. And this is the reason, and it's already been approved for the state of Connecticut, but we obviously want to make sure it goes through the legislative process. Representative Steinberg.
Thank you, Mr. Chair. Listening to the comments of some of our colleagues here today, it seems that the commitment by the hospitals is critically important. Maybe the chairs could help us understand the nature of that commitment, and if at some juncture hospitals can determine it's no longer in their interests, depending on funding, given the uncertainty in Washington.
Thank you. So I can share, look, it's no secret that the hospitals are struggling in our state. And it's no secret, as my colleagues have alluded to, the fact that Medicaid rates haven't gone up. The Medicare rates are not going up either as well. So a combination and the bureaucratic processes that have been instilled through the insurance industry are making it more and more difficult for the healthcare systems to be able to have a robust survival. So I think that's part of the difficulty. The federal government program obviously is to try and shift the restricted Medicare dollars to primary care so we can prevent hospitalization. And the rationale is that we cannot increase the total amount of money, perhaps in Washington, D.C., but if we were going to use the existing amount, that would be moved more towards the primary care, which would reduce hospitalizations and less acute care. And that's the rationale for this. Now, because of the current status of the healthcare systems or the hospitals, they obviously are panicking to some degree because of this is to happen. I can also just share that most of the healthcare systems have an outpatient and an inpatient version, but the global amount of money that they would get would be more or less the same or perhaps more, because it will only be shifted from the inpatient towards the outpatient, and more wraparound services and other opportunities may be provided to reduce the admissions to the hospital or readmissions to the hospital with enough services. And I think that's a rationale. That model does work. If we did not have the financial struggles that they were all going through, the anxieties would be far less. I think that's what we are facing from the healthcare systems. No healthcare system right now is super excited and raising their hand and saying, we want this. But at least what we feel this bill is in our conversation are 2 components. This is not the final version, but we need to move this and continue the conversations. We are limited by the timelines in this building most of the time. And that's why we want to try to get this out of the committee today and then continue to work on it in collaboration with the hospitals so that we have much closer to where they would feel comfortable. They will always have the right not to choose this, and their current programs would not be affected in any negative way. So if there's a hospital A that says that I want this, and they will be able to put more money in their outpatient, they will be able to help themselves. And a hospital B says, I want to maintain the status quo, I don't want to take the risk. They will be able to maintain the status quo and continue to have the same amount of reimbursements from the Medicare, just like it would have been otherwise. So it doesn't change anything for somebody who's not opting out or not choosing to opt in. Now, let's say every single hospital in the state of Connecticut says that they don't want to do this. They have that right. The program, the money that the state will still get for the $12 million would still be implemented. It would not be taken away. The final point that you made with some recent changes in the federal government, would this program still be there? So when we asked this question in the public hearing, we were informed that as of right now, we have no information or indication that this program is changing. So we are on target on where it is at. But we are just working with that mindset, like at close to noontime, There's no information about this, but who knows at 12:05? So that's why we need to pass it before that.
I think we all feel the pressure, but if I could just do a quick follow-up.
Yes, please.
First of all, I can't think of a better place to spend any extra dollars than on primary care, given how much it saves us through the entire system. So this is a laudatory objective. I guess the question I have, given that it's a federal program, do we have any flexibility in writing our piece of it such that if a hospital ends up with buyer's remorse after a period of time, they don't remain obligated?
I love that point. I think as legislators, we may have that option, but I will have to do a little homework to find out if the grant has some conditions. So it is worthy, but it's a good point. Thank you, Representative Steinberg and Representative McCarthy-Vahey.
Thank you very much. Just in response to Representative Steinberg, as you did address the chairs plural. So I want to thank Senator Anwar. A lot of questions remain for all of us when it comes to the future of funding for our hospitals. And that is because of conversations that we have to have here in the state that go well beyond the bill itself, that go to the ongoing conversations around the hospital settlement tax. We also, the reality of the discussions at the federal level in terms of what kind of Medicaid dollars we can expect to receive remains uncertain. We've heard proposals, but we don't know. And again, here in our own state, I think in this committee, we hear a lot of support, and certainly in other committees, I'm looking at Rep. Gilchrist, for increasing our state Medicaid rates. And we've heard very clearly from providers at hospitals and across the state how essential that is to provide life-saving services, prevention, primary care, everything. All of those questions remain. Today, as we ask you to vote this bill out of committee, we are very cognizant of those questions and the context in which this conversation is happening. And in fact, this bill cannot be a separate conversation. It has to be had in the conversation around it going forward, has to be had in the context of those other conversations. I think that's what Senator Anwar and I are committed to doing. We, in fact, have a meeting scheduled, I believe, this afternoon with our ranking members and others to continue discussion about this topic. As I said at the beginning, and I will continue to say, we are going to remain in conversation with our hospital partners and with our state and federal partners to figure out the best way forward, because we all know that we rely on our hospitals, our healthcare providers, to provide life-saving support for us every day. So it's with that in mind that I am moving forward and voting yes on the bill today, knowing that we have many, many days and hours of conversations ahead on this topic.
The ahead was used strategically. Yeah, the ahead model. Representative Mara and then Representative D'Amico.
Thank you so much, Mr. Chair. I guess I have a couple questions. One, it sounds like these are federal dollars that we may not get in the state of Connecticut if we don't do this. Is this correct? This is new dollars that we could have access to in the state of Connecticut if we implement something like this.
Yes, correct.
Okay. And
let me just rephrase that. It's already been approved. And we feel strongly that whenever there's a federal, at least I can say many of us would feel strongly, even if there's federal approval of some of the things, it should still go through the legislative body. And that's why it becomes relevant.
Okay, thank you. And then, so then my next question is, in order to get this grant money from the federal government, I'm assuming that there are parameters around it. And do we know what those parameters are exactly so that we can tailor it? Because as I'm looking at this bill, I don't see anything about primary care physicians in this bill. This just kind of is a methodology type bill. So I'd like to really understand if there are parameters that we can hone it in to specifically primary care.
We can try to get you more of that information. So this is about initiating the project, and this is about putting more money into prevention of hospitalization. So yes, we can get you that information.
Okay, thank you so much.
Yes, Representative McCarthy-Vahey.
Thank you, Mr. Chair. I appreciate that. And thank you. Also, just to add to that question, the statute and the bill before us today is basically, it's an enabling statute that would allow DSS to offer this model to the hospitals. I know offering maybe a not the word that the hospitals would say, but that would be an option. So what we are really doing is an enabling statute. I think to your point and to your question, those are some of the questions that have come up in other committees as well, in terms of what kind of input and oversight we as a legislature would have. And I think that's part of the ongoing conversation.
Rep. D'Amico.
Thank you, Mr. Chair. So I have a procedural question and then a couple other questions and maybe a couple of comments ultimately. So I'm looking at testimony that was submitted a couple of weeks ago when we had the public hearing on this bill, and it suggested in the testimony that was submitted by Disability Rights Connecticut that MAPOC was not informed of this, at least as of February 3rd, when this testimony was written. MAPOC was not informed of this plan, and my understanding is that MAPOC actually didn't have a discussion about this until just this past Friday, 5 days ago. Does that comport with your understanding of how this was done procedurally?
So they're required to, from what I understand, DSS and OHS are required to have it go through the legislative process. And then once it's moving in that direction, then everybody will be informed.
Okay, I'm just questioning the timing of when everyone was informed, but that's okay. We'll leave that aside. So I share the concerns of several of my colleagues about this proposal, and I appreciate the good comments from both of the chairs. That we want to keep this moving, that we're going to have more discussions, that it's that it's a work in progress, and all the other catchphrases that we have around here. But I am questioning just the basic model itself. I'm not so sure that I want to keep this moving. I am not so sure that I want to keep this alive. And it's not just me, because who cares what I have to say? I'm looking at what Disability Rights Connecticut has to say. I'm looking at what the Connecticut Hospital Association said in their testimony when we had the public hearing. I'm looking at what Middlesex Health had to say. I'm looking at what the Connecticut Health Policy Project had to say, and they all have really serious concerns about the model itself. You can dress it up as much as you want, Mr. Chair. You can call it a global payment methodology, which I guess is what it is. It's a block grant, and I think in this state and other states, we have seen that block grants, particularly when it has to do with healthcare, don't work out so well for the patients necessarily. I'm questioning the model itself, and some of the testimony, as I'm sure you're aware, because I know you read everything, suggests that there may be an incentive for hospitals who choose this model. There may be an incentive for them to restrict or somehow ration care that they provide because of the financial structure. One of the testimonies suggests that a hospital can make more money by restricting access to care for Medicaid enrollees. The Connecticut Hospital Association, well respected, obviously, questions that this may diminish access and affordability. The Connecticut Health, where is it? The Connecticut Health Policy Project, they suggest that a HEDS global cap carries a far stronger incentive to underserve and avoid expensive payments. All of these comments are really troubling to me, Mr. Chair, and I'm sure they're troubling to you as well. The other thing that bothers me was this suggestion that somehow this is voluntary for hospitals. Well, I'm not so sure that that I would use that word voluntary, but be that as it may, it certainly isn't voluntary for the patients, because once the hospital has chosen to use this method, then the patients of that hospital, they have no choice. They're stuck with whatever the hospital decided to do. So there are a lot of red flags here for me, Mr. Chair, and I share the concerns of the previous members who spoke on this, and I'm going to have real trouble supporting this. And I would suggest that the acronym AHEAD doesn't really reflect what's going on in this bill. I would suggest that the acronym BEHIND would be more appropriate, because this puts patients behind potentially, as opposed to putting them ahead. Thank you, Mr. Chair.
Thank you for your comments. Representative Mara, I'm sorry I moved to Representative D'Amico, and you had another comment or question. Sorry.
Thank you. No, I appreciate Representative D'Amico's statements, and I was going to move into, I think as we're moving forward with this bill, if we do move forward, I really am not sure. I agree. I'm not sure that this is a solution that we're looking for with our problems here. I think that, you know, digging more into Medicaid reimbursements is a better way forward for our hospitals, and this is kind of a solution to the wrong problem. So, thank you.
Thank you. Seeing no other comments, I just want to add a couple of thoughts, and I appreciate everybody's concerns. And the chairs did not write this bill. This is coming from our agencies, and we do respect them. They're coming based on, and the title global was decided by the federal government. So we did not decide this either. And the AHEAD name was also decided by the federal government. So we did not decide that either. It's been used at multiple states as well. So I just want to clarify so that people don't look at that, oh, what are these chairs going to do? They're running in this direction. I just want you to know that the capitation model is what this is looking like. And the capitation model, if done right, can be helpful. And if not done right, it can be pretty bad. And I think that's where everybody's anxieties are at this point. And we also know that if it is not done right, it can be very harmful. The way the current status for the hospitals is that there's no luxury for something to go wrong. So I completely empathize with the concerns people have raised. And also just know that this bill, if it is not going to have some of the issues and concerns addressed, this bill, even if it passes out of this committee, is not going to go beyond that. But at the same time, at this point, I do feel it's worthy to move forward and continue to work on this, not for the 12 million, but more so for having this model be available to look at, because it is plausible, fast forward a few years down the road, that this would be the only model that would be there for Medicare, because the money isn't increasing, and we know that the efficiency improves. So the principles of front loading it in primary care and outpatient treatment with wraparound services works. We have entire Europe, parts of Western Europe, it has worked and continues to work. We know that. But at the same time, we know that the healthcare systems are struggling. So this model may not work for every place. But if federal government is putting these programs to make them universal in future, that's my understanding. And if we don't get a head start on this AHEAD program, we will be a little behind to implement it when there's going to be a mandate that will come our way. So I just want us to keep that in the back of our minds. We may feel that we are in control, but we are really not in control of the federal money. We are frankly not even in control of the Medicaid money, even though we want to. I mean, I've not met any legislator in this building who said we should reduce Medicaid funding. Every single one of us do. But where's the money going to come from? Because the federal government is not excited about giving us more money for health and human services department. So these are the ground realities we are living with. And we have an opportunity to be somewhat better prepared, because if we are not prepared, then we are prepared to not be in good place. I just want to put that in perspective as we move forward. And this is not the final vote today. This will hopefully come out of the committee, and then we'll continue to work on this and look at the pros and cons. And I bet we'll see models within our state. We have enough individuals with insight of how this can work right in our state. But the good thing is that the hospitals, if they feel uncomfortable, they don't have to be part of it. With that, I have Representative Zupkis. Thank you.
Thank you, Mr. Chair. I just wanted to make a comment. I agree with all of the concerns on both sides of this circle. However, and I know this bill is before us, so it was brought to the committee and it's going right to the floor. And so that concerns me a little bit because there's obviously a lot of work that needs to be done here. So I am definitely a no, as I'm sure a lot of people, hopefully most people are, that this will be stopped here. Because if it's going to the floor and all the work, I've seen it, I've been here long enough to see that that doesn't always happen. And so I am concerned about the process of moving it out of this committee, knowing that it's, I won't say a disaster, knowing that it is needed a lot of work, and to leave this committee and go right to the floor, personally, I really don't appreciate it, and I don't think it's the right thing to do. Thank you.
Noted. Thank you so much for your comments. Seeing no other comments, Madam Administrator, can we have a roll call, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Yes to voting out of committee.
Senator Marks,
Senator Marks votes yes.
Senator McCory, Senator Summers,
Summers votes no.
Representative Clarice DeChier,
Clarice DeChier votes no.
Representative Berger Givallo, Representative Biggins,
Representative Biggins votes yes.
Representative Carpino,
Representative Carpino votes no.
Representative Dauphiné, Representative D'Amico,
D'Amico votes no.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Senator Gordon votes no.
Senator Huckadell,
Senator Huckadell votes yes.
Representative Cavus DeGraw, Representative Kitt, Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez, Representative Parker, Representative Morin Bello,
Yes.
Representative Perello, Representative Paletto,
No.
Senator Rahman, Representative Reddington Hughes,
No.
Representative Ryan,
Senator Ryan votes no.
Representative Ryan, if you are online, I did not see you, please.
You see my face now.
Thank you, sir. Representative Steinberg,
Yes, and good luck.
Senator Slapp, Representative Zupkis.
No.
Thank you, Mr. Chair.
Thank you. We just want people to be aware that the votes will remain open till 2 p.m. today. The next item is announcements of time and date of next meeting. We have a public hearing on Friday, February 21st at 1:30 p.m. We want to just remind all of our members, if you have not yet received a Zoom link, please let our administrators know. So you have the Zoom link, and the next item is public hearing on Wednesday, February 26th at 11:30 a.m. With that, we'll entertain a motion to, we are going to be in recess. Enter till 2. Thank you.
Senator Huckabee.
No, I think I missed one vote.
You missed the first vote, which was a voice vote. So you're all set.
Beautiful. Thank you so much. Have a great
Thank you.
day.
Have a good afternoon.
And Madam Clerk, this is Representative Kit. If I could record my votes. Sorry for my appearance. I'm very sick.
This is Senator Marks. I too need to record my votes.
Okay, who would like to go first?
I had my hand up.
Oh, I'm sorry. I'm
That's
sorry,
okay.
Senator. You go first.
All right.
Senator Marks, you missed one voice vote, and that was on Senate Bill 1190. And act requiring.
So I didn't miss any?
What was that?
I didn't miss any votes?
You missed one vote. Senate Bill 1190.
Can you just read the name of the bill for me, please?
An act requiring nursing homes and assisted living facilities to be equipped with an automated external defibrillator. How would you like to
Yes.
vote?
Senator Marks votes yes.
And I have your vote on the second roll call, so you're all set.
Thank you so much.
You're welcome. Have a good day.
You too.
Representative Kit?
Yes, I missed both voice votes.
Okay, Senate Bill 1190.
Yes.
And the second bill is House Bill 6836.
Yes.
Thank you very
Okay.
much. Thank you.
Nothing is showing. No?
Hi, Beverly.
Hi,
Just
how are you?
I'm well. How are you? I'm just popping in to vote.
Okay, I'm doing well. Senate Bill 1190.
Yes. Cavros DeGraw votes yes.
Thank you. And House Bill 6836.
Cavros DeGraw votes yes.
Thank you. Have a good afternoon.
Okay, thanks so much. Have a great day.
Okay, bye.
Can you hear me? Okay.
Hello. Good afternoon. Can you hear me?
I can.
Okay,
How are
good.
you?
I'm good. How about you? How are you?
I'm great, thank you.
Okay. So for concepts to be raised, that part for that agenda item, that was a voice vote.
Okay,
And we had a roll call for bills to be considered for JF action for both items. So for
Okay.
SB 1190, how would you like to vote?
no,
And then for HB 6836, how would you like to vote?
no.
Okay. All right. You're all set.
Thank you.
Yeah, no problem. Have a good one.
Bye-bye.
Bye-bye. Good afternoon.
Hello, sir.
Hi, okay. So our first part of the agenda, concepts to be raised, that was a voice vote. And then for bills to be considered for JF action, both items were on a roll call.
Yes
So,
and yes.
yes and yes? Okay.
Yep.
All right, you're all good then.
Thanks.
Yeah, have a good one.
You too.
Bye.
Hey, you need my vote, big guy?
Yeah.
How many bills we had today?
So for concepts to be raised, that was a voice vote.
Okay, I'm a
then-
yay.
And then for bills to be considered for JF action, SB number 1190, that was a roll call. How do you like to vote?
Yay. Yes.
And then the second bill that we had a roll call was HB number 6836. How do you like to vote?
What was that bill? What was the name of that?
An act concerning the Department of Social Services recommendations regarding the implementation of the state's advancing all payer health equity approaches and development federal innovation model hospital global payment methodology.
Yes. Is that the
Okay.
head thing? A head
Yeah,
thing? that
yeah.
you- Yeah. Okay, I'm good with that.
All right.
That's
Yeah.
it?
Yeah, that's it. You're
Thank
all
you.
good now. Yeah.
All right,
Have a good
bye.
one. Bye. Good afternoon. Hey, so for our first part of the agenda concepts to be raised, it was a voice vote.
Okay.
And then for our bills to be considered for JF action, item number 1, SB number 1190, how'd you like to vote?
Yes.
And item number 2, HB number 6836, how'd you like to vote?
Yes.
Okay, you're all set.
Great. Thanks so much.
Have a good one. Bye. Hey, okay. So
Hey.
for our first part of the agenda, concepts to be raised, that was a voice vote? Okay, and then for bills to be considered for JF action, item number 1, SB number 1190, that was a roll call. How do you like to vote?
Yes.
And then item number 2, HB number 6836, that was a roll call. How do you like to vote?
Yes.
Okay, you're all set.
Thanks, Peter.
Yeah, have a good one. Okay. For SB 1190, how do you like to vote?
Yeah.
And for HB 6836, how do you like to vote?
Yeah.
Okay, you're all set. Have a good one. Hello.
How are you?
I'm good. Okay.
Sorry,
So,
we have all day we have a public hearing.
yeah, I saw
So
that. So let's do this
what do
fast.
okay,
Let's
what
do
do
this
you
fast.
have?
So we had a concept to be raised. That was a voice vote, so you're all good for that one. And then for bills to be considered for JF action, item number 1, SB number 1190, that was a roll call. How do you like to vote?
So this Senator Anwar voted yes?
Yeah.
Yes.
Mhm. And then item number 2 was HB 6836. That was a roll call. And Anwar
Also,
voted yes. Yeah.
yes. Okay.
Yeah. You're all good then.
Awesome. Thank
All
you
set.
so
Yeah.
much. I appreciate it.
Yeah. Have a good one. Good afternoon.
How's it going, Peter?
Going good. All right. So for concepts to be raised, that was a voice vote for
Okay.
that item. And then for
Great.
bills to be considered for JF action, they're both roll calls. So item number 1, SB number 1190, how'd you like to vote?
Yes.
And then for HB 6836, how'd you like to vote?
Yes.
Okay, you're all set.
Thank you.
Have a good one.